If you've seen that viral MRI scan showing years of filler treatment and claims that 12 ml of filler turned into 28 ml, you're probably feeling quite alarmed. Well, let me explain what really happened because I know this case intimately. This is actually an MRI that I prescribed here in the United Kingdom. Now, here's the truth behind that MRI. This patient in the scan came to see me because she was concerned about dark under eye circles. She had tear trough filler 8 years ago by another practitioner. She thought that it looked dark. On assessment, I realized the darkness was actually caused by something called Tyndall effect, which is a blue-gray discoloration that you can see when filler is injected too superficially. I advised her that actually more wasn't going to solve the problem, and instead to dissolve it. But she was understandably hesitant. She was worried what it might look like after, and she's a celebrity that's probably graced your screens. She had a lot going on at the time, so she didn't really want to have it dissolved. So about a year later, we did a laser resurfacing treatment for skin rejuvenation and skin tightening, and she experienced some unexpected swelling. So as a precaution, we sent her for an MRI scan to assess the tissues, and the scan showed significant amounts of residual filler all across her face, which makes sense because if you've had filler treatment, guess what? Your MRI is going to show up that you've had filler treatment. Now, filler placed in the wrong plane will linger far longer than it should. Filler sitting above the muscle in the tear trough can last many, many years. So when she could finally see the filler that you can see here in green, she understood what I had been telling her all along, which is that there was a significant amount of superficial filler sitting in the tear trough, and she agreed to then dissolve it. And after that, she was referred to a surgeon in the USA for an opinion on a surgical blepharoplasty. And unfortunately, that MRI image was shared publicly without the correct clinical context. Now, this MRI went viral with claims that 12 ml of filler had doubled to more than 28 ml, and that filler is building up in people's faces, causing lymphatic drainage issues. But here's the truth. The volumetric analysis that is done on an MRI is not accurate. Now, we did the volumetric assessment here in the UK with the brilliant radiologist Dr. Simon Morley, who actually invented the use of 3D imaging after an MRI to assess filler position. And what we found was crucial, that the margin of error for assessing filler on MRI is huge. Why? Because the T2 signal that an MRI uses to identify fluid in filler also picks up fluid surrounding the filler in the same region. Now, that might include edema or swelling with lymphatic fluid that sits around the filler, or even blood within the blood vessels in the area. So, no, you cannot precisely measure or distinguish between filler and fluid on an MRI in the area where there's filler. And therefore, it is not a reliable way to say that there's 28 ml of filler from a scan like that, because that is just an estimate. And unfortunately, this kind of misinformation that can be shared on social media adds to fear and confusion and worries people. So what's the key takeaway here? Does filler cause lymphatic issues? Well, actually, filler is not the problem. The problem is poor technique, poor judgment, and a lack of ethics. Trying to solve a problem like superficial filler by adding more filler in is never going to cut it. That's why it's critical to choose a qualified medical professional, check their credentials, of course, on the GMC, GDC, or NMC register, ask about their training and their complication management and how they will hold your hands if something does go wrong. But more so, it's important to understand, does filler continue to expand over the course of years and sit there forever? Well, filler can last a lot longer than we once thought. And it breaks down very, very slowly, but it does break down because you have a naturally occurring enzyme called hyaluronidase, which is an enzyme that breaks down hyaluronic acid. That breaks down your own natural hyaluronic acid as you age, but it will also break down filler hyaluronic acid. Now, when you first place filler, it will swell because hyaluronic acid is a sugar molecule. It's a biodegradable, biocompatible gel implant that is made of a sugar molecule and is used to replace volume in areas where you've lost volume. And it sucks in water. Generally speaking, we say that hyaluronic acid holds 1,000 times its weight in water, but you're not going to get 1,000 times the swelling. What will happen when hyaluronic acid is injected is because of the uptake of water, the surface volumetric change will improve over time. Bear in mind that initially, when you have an injection, you're likely to have some localized swelling. So the reality is, once you've had an injection of filler, on the day, you're probably seeing the filler and the swelling. Once the swelling goes down, what's left behind is the filler that may have undergone some degree of expansion due to the fact that it holds on to fluids, but there is no evidence that it continues to enlarge after the course of 3 months. And that's why we often do these treatments over a course of sessions, so we can assess how the filler integrates in the tissues and see if more is needed over time. And again, this comes down to ethics and knowing that less is more. We don't try to fill your face like an eclair. We try and artistically, precisely, and strategically place the filler to replace lost volume where you need it. And so it's important that you find a practitioner who has the integrity to say no, the ethics to guide you, and the honesty to have difficult conversations if necessary. Like with this lady, when she came in asking me for more filler in her tear trough, my answer was no, because I knew that more filler in an area that was already overfilled with superficial filler was not going to be the answer. But sometimes patients can get used to what they look like and they can't see the filler that's been lying there for years and years and years. And yes, if filler is sitting superficial, then it can block the lymphatic drainage and it can exacerbate puffiness in the area. And the best solution in those cases is removing the filler. And that is the beauty of hyaluronic acid fillers, is that they can be reversed safely off-label with an enzyme called hyaluronidase, which is a prescription-only medication. And that's why it's so important that you see a medical professional who can prescribe and procure this medicine when needed. So, if you're considering filler, but you're scared by this MRI that has gone viral, please remember that bad news makes news. And also, consider who might be benefiting from the misinformation and the reality of how this might be landing with patients. I hope this has helped. If you have any questions, please pop them down below. Remember to subscribe and like, and I'll see you in the next video.